I'm Dr. Aleem Surani. I'm a pulmonary critical care and neurocritical care specialist and the director of ICU services at Sierra Medical Center. Some tips for maintaining good lung health. The primary thing, of course, is to avoid smoking. And when I say avoid smoking, I mean avoid smoking in all its forms, including passive smoke inhalation, including secondhand smoke. Second, avoid things that are noxious. So what I mean by that is things that irritate your breathing. Avoid them. The lungs are a reactive organ. They react to the things around them and the things that they're exposed to. And of course, if you have issues where you're being exposed to things that you can't avoid, that's a good time to see your doctor, see your provider about being treated for those things. And finally, maintaining good cardiovascular health. So the lungs work in concert with your heart to help you maintain a good functional status. And the old adage of if you don't use it, you lose it is very true with the lungs. So stay active and exercise. So common risk factors for lung cancer, of course, smoking is the primary risk factor responsible for the development of lung cancer. By far and away, smoking is the thing that puts you at the most risk. Another common risk factor is family history. If you have a close family member who suffered from lung cancer, unfortunately, that does put you at increased risk as well. And that can occur even if you're not a smoker. Third, radon exposure, which is pretty common here in Northern Nevada. Sometimes it's worth going to a hardware store and obtaining a meter or sensor to check radon levels inside your home if you're concerned that you could be exposed. And then finally, there's good correlation with high degrees of secondhand smoke exposure in the development of lung cancer, so where you can avoid high smoke areas and environments. So the recommended screening for lung cancer is something called a low-dose CT scan of the chest. It's a specific type of CAT scan that is protocolized to administer less radiation than a typical CAT scan for the purpose of being able to screen you every year. Screening is indicated in folks who are 50 to 80 years old with greater than 20 pack year smoking history and who are either active smokers who have quit or who have quit within the last 15 years. And a 20 pack year smoking history, that can mean 40 years of smoking half a pack per day. That can also mean 20 years of smoking a single pack per day. If you fall into that category, you should speak to your provider about getting a yearly screening CT to look for lung nodules. If something is found, they'll refer you to a specialist. It's something that might be helpful in catching things early while they're more treatable. Some common treatments for lung cancer. The treatment for lung cancer is intimately associated with the stage of lung cancer, and that's where screening for lung cancer becomes very important with that low-dose CAT scan of the chest. Early stages of lung cancer can be treated with surgical resection and then possibly addition of chemotherapy. At later stages, treatment focuses more on delaying progression. That's with chemotherapy and radiation therapy. And there are a lot of new chemotherapies that use your immune system to make specific targeted attacks depending on the type of cancer that you have.